order to take the healthcare infrastructure in terms of creating the manpower, etc., I think this government is already going in the right direction. If you must be aware that every district hospital is going to be converted into a medical college and a nursing college. So that would give adequate number of clinical workforce for the country. And as you might be aware, that there are two programs which the government is focusing on. One is Heal in India and other is Heal by India. So Heal in India is essentially for people who come from other countries to seek healthcare in our country. And at the same time, we could have another source of exporting manpower to provide services and care to other countries, other part of the world, especially as you know that the nursing workforce all over the world is in short supply. And if we are able to produce larger number of nurses and doctors, we can serve a larger population, and that could be a very good source for remittance. As far as our ask is concerned, I think private healthcare investments have to be looked from a different lens compared to a regular corporate. And that is what will make a difference. Currently, healthcare has to operate in all the parameters which are same as any other business. And if they have to provide that kind of returns and they have to be responsible to their stakeholders, they can obviously have certain constraints in providing the level of service or the kind of service which is required, especially to the economically disadvantaged people.
So very quickly, my second last question, because I know we have the finance minister here at 6. Earlier, medical colleges, by and large, at least some of them were a complete racket. There was capitation fees. It was a bizarre situation. Do you see a significant change in that, which means we now have better manpower? And I'm talking about both skilled and non-skilled.
Yeah, so a lot of reforms have been done in medical education in the past 7-8 years. And the medical council concept has been changed, and that has brought in a lot of transparency. The digital health will bring in further transparency. The information will flow freely. And the whole medical curriculum also has been revised. So with that, we would definitely have larger number of supply. Then comes the question of quality. The government is very keen to look at accredited institutions, and they are making sure that all the insurance providers, etc., are ensuring that the hospitals are accredited and there is a certain kind of quality and safety in patient care in those hospitals, whether be public sector or private sector. So definitely once we have larger number of availability of clinical talent, automatically the standards will also improve. Indian doctors are second to none.
Last question. My late grandmother used to force me to have haldi, black peppercorn, nimbu in a, well, tequila shot glass. She didn't know it's tequila. And that created a level of immunity, and I never got COVID, touch wood. Do you believe the time has come as India enters its Amrit Kal? We've brought about a huge fillip to Ayurveda, to traditional medicines. Do you see that playing a great role? Because A, of access, and B, of cost?
See, our traditional medicine has got a very important role in especially managing chronic illnesses. And that has been proven for a long time. However, modern research methodologies have not been used, but that is started to happen now with the current government. And these things are coming into focus now, and as a result of that, I am pretty sure that our traditional medicine, Ayurveda, and all other systems will play an important part in the larger ecosystem of healthcare.
Dr. Raghuvanshi, thank you so much. He is perhaps the only professional running a large chain. Otherwise, most of them are owner-managers, and therefore their interests and their incentives are slightly different. I'm not saying dishonorable, only different. Thank you for being a delightful audience.